All right, we are live. So Tuesday at 5:30. I'm 5 minutes late. Apologies. We've got a couple questions lined up. So this is our Woodlands Plastic Surgery Q&A. Join us live. You're welcome to ask questions live. We'll get to what we can. Typically, we go about 15 minutes and change. And then any questions we miss, we'll put them back next week, or sometimes we'll go long if they start kind of building up and things like that. So at the top of the list is how long do drains stay in for a tummy tuck? In general, it's usually just about a week. If we do a lot of liposuction, sometimes they stay in a little bit longer. And then also depending on anatomy and anatomic variability and things like that, they might stay in longer. Typically it's one drain, sometimes it's two. It just kind of depends on how much space we need to actually drain and all of that. So, but they serve a very important function. They're kind of a necessary evil in the sense that nobody likes them. It's not pleasant. If we didn't have to use them, we definitely wouldn't, just because it's not a fun part of the recovery. But it's an incredibly important part of the recovery because it prevents complications, prevents fluid collection, seromas, things like that. And then in the case of liposuction, it's also a helpful adjunct because it actually collects a lot of the fluid that would normally drain out by other means in a more controlled fashion. And so that it serves an important safety function, and then also an important kind of practical function in terms of just managing the body's normal reaction to the fluid changes of surgery. So, but anyway, to answer to your question, usually about a week, sometimes 2 weeks. They can stay in longer, but again, the vast majority is in that 1 week range. Okay, let's see what's next. When do I need a facelift, or can I get away with non-surgical treatment? Complicated question. What I tell people when it comes to facial rejuvenation is that there's kind of three big tools in our bag. One is surgery. That's kind of a big tool, so to speak. One is your skincare. Skincare is a huge topic, obviously. That covers everything from lotions and creams, things like that, to chemical peels, to every laser you can think of, to secret RF radio frequency treatments. It's a huge topic, but it's basically topical treatments of the skin. Last on that list is, but not least, certainly, is your injectables. So that's your Botox, your Dysport, your fillers, your Juvederm, your Restylane, things like that. And so those are the three big tools we have. One big surgical tool, and then those other two non-surgical options. Ultimately, the intersection is basically how severe is what we're trying to treat, and then how dramatic of a change are we trying to get. So for example, you could have two people that have kind of a similar appearance in terms of facial aging. One says, hey, I want to turn the clock back 10, 15 years. I want all these wrinkles gone. I want my jawline tight. I'm tired of this. I want everything. Other patients say, I don't really want surgery. Is there just something I don't like this right here. This bugs me. Is there anything we can do for that? I'm not really in the mood for surgery. And so you can have different priorities. And so for patient A, I might say, okay, well, you definitely need a facelift. We've got to do the full Monty, full facelift, neck lift, define the jawline, treat the jowling, maybe throw in some fat grafting to volumize. We might throw everything at that from a surgical standpoint. The other patient might say, okay, well, let's temporize. You're not going to get as dramatic a result. You'll get a partial correction, but it's non-surgical. It only takes 15 to 30 minutes in the office. You'll get a noticeable improvement that will last for several months to a year, and you get to avoid surgery, and obviously it costs less than doing a facelift. And so there's some subjectivity in terms of when you need a facelift versus not. From a surgeon standpoint, or if I'm teaching a resident, a plastic surgery trainee, how do you make that decision making? Ultimately, the reasons we think about doing a facelift or recommending a facelift is if somebody has really well-defined jowls, it really is starting to descend and hang. If somebody has loose tissue of the neck, where you're starting to get skin hanging down. If we've got a lot of laxity in the mid-face or the cheeks, these are things that really can't be corrected with non-surgical means. They can be improved. They can be noticeably improved. The skincare, the non-surgical methods, again, are extremely effective. They're as good now as they've ever been in the past. but again, it's like a tummy tuck. There's no way, no non-surgical means is going to get rid of that skin. I joke that the only thing that really gives plastic surgeons job security from a surgical standpoint is the fact that nothing can reverse skin changes. Nothing can get rid of the skin, excess skin that is built up. It's surgical. And so with a face, the way that manifests is extra skin, jowling, loss of the jawline or loss of definition of the jawline, laxity of the neckline, and those are the kind of the hard indications for when we do a facelift or not. That being said, again, at least in my practice, we ultimately individualize recommendations. And the way I phrase it to people, because these are sensitive topics, there are self-esteem issues at stake, there are budgetary and financial concerns at stake, which can also be sensitive topics. There are a lot of concerns to be addressed, and so I just try to delicately make recommendations about what you're a good candidate for, what you're going to get the most dramatic result with, what you're going to get a noticeable result with, what's a waste of money, frankly, or what's overkill. Today I had one patient who wanted a neck lift that I talked out of it and said, you're wasting your money. If we take before and after photographs now and 6 months from now, you're going to have to stare at it with a magnifying glass to notice any difference because it's just not severe enough. And I said, hey, let's do some skincare. Let's do Secret RF. Let's maybe consider Kybella. And we can do some skin rejuvenation to tighten the skin. And that's going to give you, frankly, a better result than a neck lift would do. And in the same clinic, I had a patient come in who's interested in a facelift but kind of scared about surgery. And so I had that conversation with her today and said, a facelift is the fix. It's going to give you the best result, the most dramatic result. You're a perfect candidate for it. However, if you're not in the mood for doing surgery, or maybe just not right now, it sounds like a good idea, but you got stuff going on, or you're just surgery averse, and hey, these are our non-surgical options where you're going to get a noticeable improvement. It's going to look better, but is it going to take a jawline or a jowl, make it disappear, redefine that jawline, really dial the clock back? No. However, will it be a noticeable improvement? Yes. And so ultimately the patients kind of take that information, go home, mull it over, and decide which path they want to go down. So that's the kind of basic gist of it. Let's see, I can't read my own writing here. What does it mean for skin to shrink wrap? Typically that's in the context of a liposuction discussion. What that's referring to is the elasticity of skin. Skin, collagen, dermis has elastic properties. If you take, I'm right at that middle stage, if you pinch the back of my hand and look at that skin, it snaps back down at a certain rate. If you do it to a 12-year-old kid, it's going to snap back lightning quick. If you do it to maybe your grandmother who's got some more years on you, it might even stay there for a little while, or you might have to kind of iron it out a little bit to actually get it to go down. And that's a good kind of measure of elasticity. And that's really what that shrink wrap concept refers to. When you do liposuction, you're effectively emptying out all of the fat in that subcutaneous area, thinning it down. At the time of the operation, the skin's somewhat loose because there's empty space. It's no different than anything else. If a shirt is being worn, it fills out. If you take the shirt off, then it just drapes, right? Same concept. So the skin, depending upon how much elasticity you have, how much laxity you have, those are two different ways of saying the same thing, will dictate if you're a candidate or not for liposuction, because you shouldn't do liposuction in people with poor skin as a general rule of thumb. And then it also leads to how fast you get your result. So how I counsel my patients if we're entertaining the idea of liposuction, because everybody wants their results right away, of course, obviously. And so I just try to be realistic and say, hey, if you're 18 years old and you just have some stubborn fat you can't get rid of, your skin is so elastic, you've never had a kid before, you're a relatively healthy weight, your skin's got perfect elasticity, you're going to see your liposuction result really on the faster end, which is around 3 months time, because again, that skin shrink wraps down, all that empty space left behind by the liposuction cannula, it just suctions right back down, and that's a pretty quick process. Again, going back to the hand analogy of kind of pulling that skin. Whereas somebody who's a little bit older, maybe we've had a baby or two, maybe we've got less skin elasticity for genetic reasons, or maybe we're just on the older end of the spectrum, they say, hey, we're gonna have to be more patient. It's gonna take 6 months, maybe longer, for that skin to kind of react to that and shrink right back down and demonstrate that contour that we developed with the liposuction technique. And so that's what that refers to. So yeah, that's the shrink wrap concept. Let's see what's next on here. Can you talk about Sulfina? So Sulfina is an FDA-approved treatment for cellulite reduction of the buttocks and thighs, generally the buttocks and posterior thighs, and that's the most common area that people get cellulite. You can also get it kind of on the lateral thigh, but it's generally kind of the posterior aspect of the buttock, posterior thighs, lateral thigh. The Sulfina technology is it's a minimally invasive or non-surgical technique. It's done in the office. It's done with basically local anesthesia. And the technology effectively cuts the fibrous band that leads to the dimpling of the cellulite. And so cellulite is basically caused by a fibrous band that kind of connects the skin down to the muscular fascia, or just kind of the deeper tissue underneath, if you want to think of it that way. And so the way that you fix that is you go and you physically cut that fibrous band, and then that dimple pops back out again. It's intended to be a one-time treatment. That's one of people's most common concerns. The two most common concerns of people coming in for cellulite treatment, and Sulfina specifically: how long does it last? How many treatments do I need for that? And understandably, I mean, cellulite, some 85-90% of people, of women, have cellulite that bothers them. It's probably the most common cosmetic problem that people have that's really not weight related. It can be impacted by weight, but there's people who are a completely healthy weight who have really bad cellulite. And similarly, there's people who are very heavy who don't have any cellulite. So anyway, there's kind of a genetic component. But because historically there have been such poor treatments and so many gimmicks and so many just gimmicks that just don't work, people have tried, spent money on that. People are naturally skeptical of anything related to cellulite, and understandably so. But the good news with Sulfina is it is FDA approved. That means we've got studies that have demonstrated that it's effective. And then my experience with the technology has reinforced that. The patients have been overall very happy with the results. And it's something where the photographs do demonstrate really excellent improvement, if not complete correction, a dramatic enough improvement where it's clearly kind of a game changer in terms of the result that you get. So I've been very happy with the results. But the procedure itself, so again, done in the office, I call it minimally invasive just because it does involve kind of a needle stick or needle technology. Most people don't feel anything after we kind of get the numbing medicine on board. And then in terms of seeing your results, people do notice changes as early as, even 2 to 4 weeks after the procedure. In that sense, it is more similar to a surgical procedure because the results evolve over time because there's kind of a healing process involved. And so I tell people kind of look in the mirror or look at photographs every 3 months and just kind of check in, so to speak. The technology's been out for, I want to say, about 5 years now. And the good news is that the patients we have that we've been following over this time period have continued to improve, generally speaking, over time, presuming that their weight and other variables have kind of stayed the same. So when you follow them over the time, the results actually seem to mature even more with time. But in terms of, oh, hey, I just got my treatment, when am I going to get my results? 3 months. 3 months, you'll start seeing significant, noticeable improvements, and then expect it to get better for at least the next year or so. So, let's see. I think that will be it for today. I think we've covered kind of our 15 minutes. Again, I like to keep it kind of brief and kind of quick and easy, so to speak. So keep the questions coming. It's fun. Hopefully you guys are getting something out of this. Tell your friends about it. Spread the word. No questions off limits. Try to keep it to plastic surgery, but no questions off limits. Throwing some curveballs about some celebrity botch jobs. Throwing some questions about, are those real or fake? Whatever you guys want to throw at me. Like I said, nothing's off limits. Just keep it related to plastic surgery. All right. Well, have a good rest of the day. Happy Tuesday. We will see you next week at the same time. and hope everyone's having a good April and a good spring. All right, bye-bye.